Hello everyone, in this presentation we will talk about diagnostic imaging in oral and maxillofacial surgery. First we will start with digital imaging. Digital imaging uses the same procedure as plain radiograph, but instead of the normal form we will use special sensors. These sensors can be wired or wireless. The image then transferred to the computer, whereby a software program will enhance and process the image. Digital imaging gives the same value as plain radiograph, but with certain advantages. We will find out in the next slide. The first advantage is we can inverse the color. The area of radiolucency in this original image will be highlighted as radio opacity. This will give us a clear view of areas of interest. Also, we can have alteration in contrast. As you can see, this is the original image. This is the image after alteration in the contrast. You can see the highlighted area here is more clear. We can also have a magnification of area of interest, as you can see in this picture. We can also enhance the image and make it look as a 3D image, as you can see in this picture. The most important advantages of using digital imaging is the automated measures. We can do a very accurate measures using special computer software. This was very helpful in treatment planning and in diagnostic in implant surgeries, as you will see in the next slide. In this slide, we are measuring if we have a sufficient remaining bone to do an implant. This is the maxillary sinus floor, and here we have an implant. The remaining bone is sufficient according to the measurement, and we are determining the best alignment for dental implant. In this slide here we have a series of photos taken before and after dental implant. Here we have a bone after insertion of the dental implant, after insertion of the couping, and here after the restoration. You can see the bone thickness here and after 3 years. This is very helpful to monitor the progression of dental implants. Computed tomography, it uses ionizing radiation to give us imaging of a variety of structures in the body. It's now considered as gold standard in oral and maxillofacial surgery, especially in cases of trauma, as we will find out in the next slides. The images taken using computed tomography are named slices, and they are taken in 3 sections. This is the axial section, this is the sagittal section, and this is the coronal section. The displayed images are in 2D. With the advancement of technology and the use of special software, 3D reconstruction of CD images has happened. As you can see, this is the skull in 3D. By combining the slides that are taken in 3 planes, axial, sagittal, and coronal. CT scans are used in diagnosis of intracranial hemorrhage or masses. As you can see in this axial slice, we have the area highlighted as a radio opacity. This is the area of intracranial hemorrhage, and this is the normal brain. Also, it is used for diagnosis of maxillary sinuses diseases. As you can see in this coronal slice and this axial slice, there is a mass in the maxillary sinus. Later on, after biopsy, this mass was diagnosed as a tumor. Also, we can know the staging of this tumor by measuring the size of this mass. CT scans are considered gold standard in diagnosis of facial fractures, especially after trauma. In this axial slice, we have a fractured mandible. This is a body fracture, and here we have a parasymphysis fracture. As you can see, this is a 3D image of the patient's skull. Here, this is the fracture, and here. In this slide, we have a zygomatic complex fracture with inward displacement of the zygoma and involvement of the lower margin of the orbit. This is the area of fracture of the zygomatico-maxillary suture, and this is the area of zygomatico-temporal suture fracture. in this 3D image, we have a better view of the fracture. This is the zygomatic-maxillary suture fracture. This is the zygomatic-temporal suture fracture, and here we have a fronto-zygomatic suture fracture. This 3D image has simplified the treatment planning to reduce the zygomatic fracture. CT scans are also used for diagnosis of facial abscesses. This patient comes to the clinic with a swelling in the angle of the mandible. After taking a CT scan, this area highlighted here as radiolucency is an abscess. In this sagittal slice, we can see a submandibular space infection, and this is the abscess. You can see that the extent of the abscess has compromised the airway. CT scans are used for diagnosis of salivary gland diseases. This is one of the most common diseases of salivary gland is silolithiasis. As you can see in this axial slide, there is a salivary gland stone in the submandibular gland. CT scan is used in diagnosis of TMJ disorder. In this coronal slice, we have a medial condylar displacement in both sides. This patient had a previous trauma in the condyle, which has led to a fracture of the condyle and a malunion. In this coronal section, we have ankylosis in the left condyle. As you can see in this 3D image, there is ankylosis of the condyle to the glenoid fossa. CT scan has some advantages. The first one is detailed imaging and excellent differentiation between different types of tissue, both normal and disease. No special patient preparation is needed. Linear measurement, area of volume, and structures can be calculated using built-in or other software. Patient in emergency, trauma patient, children, oncology, it's very helpful because scan time is less than 1 minute. Transfer of information only takes a few seconds, and this display of the image can happen in 5 minutes. Images can be enhanced using IV contrast media and providing additional information. The disadvantage of CT scan is can have an artifact, metal object artifacts. Dental filling can cause this artifact. Patient cooperation is highly needed. The least amount of movement of the patient can cause motion artifact, as you can see in this slide here. Medical radiation burden is also a problem. CT scan can equal 200 X-ray films. Cone beam CT or CBCT. It is one of the latest revolutionary cutting-edge technology in dental and maxillofacial imaging. It enables quick, fast, easy visualization of patient craniofacial structures with unparalleled precision of 3D. It provides undistorted dimensional image of the jaws in cross-section, axial, coronal, sagittal, panoramic, and 3D images. Cone beam CT utilizes a cone-shaped X-ray beam directed toward the patient's head, whereas a fan-shaped X-ray beam is used by traditional medical CT scan. Multiple two-dimensional projection images are acquired for the field of view selected according to the region of interest in CBCT. Sections in CBCT. This is the axial section, this is the coronal section, and this is the sagittal section. And here we have a 3D image, and this is the panoramic section. As you can see, there is, by this 3D, there is a dentigerous cyst around the impacted lower canal. CBCT is used in the diagnosis of oral and maxillofacial implants. As you can see, we are diagnosing if there is sufficient bone to do 4 implants for anterior incisors in the maxilla. Here we have modeling to the size of the dental implant and the alignment of the dental implant. Also, this is a 3D view for dental implants modeling. CBCT is used in the diagnosis of impacted teeth, cystic and neoplastic lesions. Also, as you can see in this slide, we have an impacted canine that has caused lateral incisor root resorption, and the primary canine is still unexfoliated. Orthodontic treatment plan can also be made using this CBCT image. This is very important in oral surgery to determine where to put the surgical opening, whether to the buccal side or the palatal side for placement of orthodontic devices. CBCT is also used in the diagnosis of facial trauma. As you can see, this is a para-semifacial fracture of the mandible, here in this panoramic view, in this axial view, and here in this sagittal view, and here in 3D view. CBCT is also indicated in the diagnosis of endodontic pathology. As you can see, this is a case of failure endodontic treatment. There is a stillborn resorption, and here we have this lesion. This tooth is indicated for apexectomy. In this slide, you can see in this sagittal slice, there is a radiolucency posterior to the central incisors, and also in this 3D imaging and in this axial slice. This is a nasopalatine cyst. Also in this slice, you see there is impacted third molar surrounded by a radiolucency. This is highly indicated of a dentigerous cyst. CBCT is also used in the diagnosis and analysis of temporomandibular joint pathologies. As you can see in this image here, we have a fractured condyle. As you can see, this is the line of fracture, and in this panoramic view, there is a radiolucency and discontinuity in the cortical bones of the mandible, showing a condylar fracture. Special uses of CBCT is in the diagnosis of airway problems like airway studies and sleep apnea. As you can see in this image here and here, this sagittal slice showing a structure in the airway causing sleep apnea to the patient. CBCT has certain advantages over CT scan. First one is high-speed scans. It takes less than 30 seconds. Compact and reduced size of the device, which make it feasible in the use for dental office. High spatial resolution applicable for maxillofacial diagnosis, and we have low radiation exposure, 10 times lesser than that for the regular CT scanner. And also it is safe for children. Magnetic resonance imaging, or MRI. MRI is the most innovative non-invasive technique. Magnetic resonance imaging is considered as cornerstone of medical practice. It produces high-quality cross-sectional images of body in any plane. MRI shows superior soft tissue contrast. MRI is used for the diagnosis of soft tissue neoplasia. As you can see in this image here, we have a mass in the tongue. This is the white area. This is the mass. MRI is used in the diagnosis of TMJ disorders as an integrity and position of the disc. As you can see in this image, here we have the ear canal. This is the base of the skull of the temporal bone. This is temporal lobe of the brain. This is the TMJ articular disc. This is the posterior attachment of TMJ articular disc. This is superior heads of the lateral pterygoid muscle. This is the inferior head of the lateral pterygoid muscle. And this is the head of the mandibular condyle. MRI is also used in the diagnosis of lymph node enlargement and malignant metastasis to lymph nodes. As you can see in this, we have a tonsil enlargement and a cervical lymph node enlargement. MRI is also used in the diagnosis of perineural invasion by malignant neoplasia. As you can see in this sagittal section, we have malignant lesion in the posterior wall of the maxillary sinus. MRI is used in diagnosis of soft tissue swelling as in masseter hypertrophy and space-occupying lesion. As you can see in this slide, we have a 4-year-old child MRI. This is coronal section. We have a temporal space infection, as you can see here. In this axial section, we have a mass in the masseter muscle. This is the masseter muscle, and this white lesion here is a mass inside the masseter muscle. MRI is also used in the diagnosis of salivary gland diseases. As you can see, here we have a mass in the parotid gland. Later on, this was diagnosed as pleomorphic adenoma. MRI is contraindicated in patients who have ferromagnetic or electronically operated active devices implanted in their body, as automatic cardioverter, defibrillators, and cardiac pacemakers. Also, claustrophobia patients who are afraid from closed spaces, bullets, pellets, and sharp nail embedded in the body is also contraindicated for MRI. Orthodontic implants, material, and devices also contraindication for MRI, as all of these can cause a distortion in the image, and also because of the magnetic field used in MRI. MRI advantages: it's first, non-invasive technique. Second, the use of non-ionizing radiation. 3, high quality image, especially for soft tissue. Disadvantage: bone cannot be captured. The only signal obtained is from the bone marrow, and it's not of that importance. Long scanning time, and this could be a problem for demanding patients. Equipment is very expensive. Differentiation is difficult as bone, teeth, air, and metallic objects all appear dark. Radioisotope imaging. Radionuclide imaging is also called functional imaging. It assists physiological changes, which is a direct result of biochemical alteration. It's composed of two components. The first one is the gamma camera, as you can see it here, and the second one is the radioisotope that is injected into the body. The most common isotopes used in head and neck region imaging are first, technetium-99 and methylene diphosphonate. This is used in salivary gland, thyroid, bone, blood, liver, and lung and heart diseases. Gallium used for tumors and inflammation. Iodine is used for thyroid diagnosis. Bone scintigraphy is a diagnostic study used to evaluate the distribution of active bone formation in the body. It depends on technetium-99 uptake by osteoblastic activity or decreased uptake by osteoclastic activity, which can denote the difference between osteoblastic lesions and lytic lesions caused by osteoclast activity. Bone scintigraphy is used in the diagnosis of tumors, staging, assessment of site and extent of bone metastasis. It shows tumors which cannot be shown by any other imaging modalities. The first one we have here in this image, bone scan of the skull showing malignant tissue in the bone. Here, this is increased uptake, and here. Also, this is showing a bone metastasis tumor. As you can see, this is the primary lesion, and this is a metastasis. Bone scintigraphy is used for assessment of TMJ disorder. This case is hypertrophy of TMJ. Here is a normal condylar bone formation, and on this side we have increased uptake of technetium, which indicate a hypertrophy and high bone formation in the left condyle. Bone scintigraphy is used in assessment of graft. Here we have zero uptake of technetium-99, which given score 0. Here we have less than the calvarium uptake, which indicate score 1. Score 2 means that the uptake of technetium-99 in the graft site is equal to the galvarium uptake. And the score 3 means there is more uptake of technetium-99 in the monograph site than in the kill value. Bone scintigraphy is used for diagnosis of osteomyelitis in maxillofacial region. This is a clinical case of a child suffering from tuberculosis. Tuberculosis causes upon osteomyelitis, as you can see in this PET scan. It's occur in the maxilla and mandible. And here also is a picture of normal skull, and this is a skull with osteomyelitis. You can see there is increased uptake of technetium-99 in this area. Scintigraphy is also used for thyroid diagnosis. Here we have a normal scintigraphy of thyroid gland. Here we have abnormal results. Decreased uptake, as you can see in this area, means cold nodule. This is a great disease. This is toxic multinodular thyroid disease. Hot nodules you can see here, and cold nodules you can see here. This is thyroiditis. There is very, very low uptake of technetium-99 by the thyroid gland. This is autonomous nodule, suppression of reminder of the gland. Only this part is working. And here we have a hot nodule. This is a normal thyroid gland, and here we have increased uptake of technetium-99. Scintigraphy can also be used for diagnosis of salivary gland function. As you can see in this slide here, this is after 10 minutes of giving the patient technetium-99. This is after 20 minutes. This is post-stimulation excretion of technetium-99 from the salivary gland. This is post-wash out. Any remnant of technetium-99 in the salivary gland will indicate there is a problem with salivary gland function. Scintigraphy advantages. First, assessment of function of the target tissue. Second, during one bone scan, the whole skeleton can be imaged. 3. Result can be enhanced. 4. Can show lesions which other imaging modality cannot detect. As you can see here, we have a CT scan. It's normal, totally normal. Here we have a PET scan showing a neck mass at this highlighted area here, here, and here. Scintigraph disadvantages. First, poor image resolution, minimum information about target tissue anatomy. Second, high radiation dose. Third, images are not usually disease specific. Fourth, some investigation takes several hours to do. And fifth, facilities are not widely available. Arthrography. This is an imaging modality used for diagnosis of TMJ disorders. Arthrography involves injection of a radioisotope contrast material into the joint space occupied by it. This can then be visualized lying between the layers of the contrast material. Arthrography provides information regarding the soft tissue component, specifically the shape and position of the articular disc, as you can see here. Since it's an invasive procedure, it has certain complications like joint sepsis, allergic reaction to the iodinated contrast medium, hemoarthrosis, pain during and after the procedure, extravasation of the contrast medium, disc perforation, transient facial paralysis due to trauma to the facial nerve. Ultrasonography is a diagnostic tool that's widely available, relatively inexpensive, non-invasive, and easily reproducible. It is very sensitive in detecting fluid collection. It can differentiate between a mass and a cystic lesion. Certain terms associated with ultrasonography. Hypoechoic. A mass is hypoechoic if its intensity is lower than that of the adjacent tissue. Hypoechoic masses are darker. Hyperechoic mass is hyperechoic if its intensity is higher than that of the adjacent tissue. Hyperechoic masses are brighter. Isoechoic mass is isoechoic if its intensity is similar to that of the adjacent tissue. The appearance of isoechoic masses are also bright. A calcified mass appears as hyperechoic, a clear fluid or blood appears anechoic, free of echoic masses. Ultrasonography is used in the diagnosis of lymph node enlargement. As you can see here, we have multiple lymph node enlargement in the supraclavicular region of the neck. Ultrasonography is used for detection of masses in the neck. Here, a patient comes to the clinic with a mass in the left neck. After ultrasonography, it appears to be the mass is a cystic lesion. It was later on defined as bronchial cleft cyst. Ultrasonography is used as the first-line imaging modalities in salivary gland diseases. This is ultrasonography taken for the submandibular region, showing the submandibular gland and its duct. If any cyanosis were present here, it will show a stricture in the duct. A special use for ultrasonography is in the guided fine needle biopsy, as we'll see in the next slide in this video. Here a needle is inserted into the mass, as you can see here on the ultrasound. The needle is inserted multiple times in different borders of the lesion to take multiple samples for histopathological sections. Here, the insertion of the needle. You can see, and here the specimen is transferred into slides. Advantages of ultrasonography. First, no radiation. Good differentiation between a mass and a cystic lesion. Technique is widely available and inexpensive. Disadvantage, limited use in the head and neck due to bone. It can take only images of soft tissue. Technique is operator dependent and need a medical practitioner. Image resolution is often poor. Thank you very much for your listening.